Let's bring in our own Dr. Marc Siegel. Dr. Marc Siegel, good to see you.
Great to see you, Liz.
One nurse described the scene saying, quote, and this is gruesome, you're standing in a pool of blood trying to care for your patient, slipping and sliding. Soon you're covered in blood yourself. The air smelled like iron. Put us inside the hospital on an event like that.
The key word there is triage, and that means you have to separate out those who are the sickest and whose life is in danger from those who maybe just broke a bone or fell or had a minor gunshot wound. Now, I'm not trying to sound insensitive, but those people could be in the way of the people who are dying, who are bleeding out. And you may not be able to see the bleeding because it may be going on internally. That's called triage. But you know what, Liz? While you're triaging, you may stabilize a person, and then you get them out of the way. Someone that has a bullet wound to the chest, that's having a rapid heart rate, high blood pressure, breathing shallowly. You suddenly find the bullet wound. You figure out the lung is dropped. You stick a chest tube in, move them out of the way. Some have to go to the operating room right away, and they have to have ways to tie off the bleeding, and that's the key. And that's why all of that outpouring of people donating blood has been so tremendously helpful.
So, you know, basically we're also talking about, unfortunately, here's a picture of the victims. Again, we don't like to treat people like statistics. We put faces out there to show you, here are the people that have been lost. We're talking about bullet wounds, right? And the velocity of some of these bullets, of a machine gun, or a semi-automatic, is like 3 times the velocity of a handgun, right? So tell us about that.
And even though the shooter was shooting from so far away and so high up, that's still a tremendous velocity. And it was made into an automatic weapon. These bullets create a big track, and they can also, if they hit a bone, they can splinter. So then you have more than one path. One thing people need to know is we don't take those bullets out unless the bullet itself is in a very dangerous area. Usually what you do is you look at sewing up organs that have been damaged, stabilizing bones that have been broken, taking out fragments of bones that are in bad places, and repairing arteries. Especially things like places like the pelvis and the abdomen are loaded with rich blood vessels. And if you don't tie them off, the person bleeds to death. You know what we do?
Like Steve Scalise, yeah.
Right. What we do is we follow the hemoglobin repeatedly. Every few hours, we look again. What's the hemoglobin? What's the hemoglobin? Because we may not know where the bleeding is, and we have to catch up with it. Now, I also want the viewers out there to know, even as we learn about these things, I don't want everybody to think this is coming to a neighborhood near you. This is not the case. We care so much for the victims there.
Yeah, we do.
And we need to learn how to apply tourniquets and how to stop bleeding, but it doesn't mean it's going to happen.
Doc Siegel, we love having you on. Come back soon.